Hey, Dr. C here with you. So, who should quit thyroid medication and how can they go about doing it? I'm going to walk you through a real simple guideline and protocol that can help someone know if this applies to them and what they would do for their first few steps. So, for starters, who and why? Who would be anyone that doesn't need the medication? Those who need it had their thyroid taken out or they had it destroyed via radiation. And they need treatment long term forever, and that's totally fine. Others had their thyroid basically shut down. And this is called overt hypothyroidism. That's when the TSH gets really high, like more than 20, and the T4 goes way below range, like close to flatlining. Some of these people need treatment long term, many of them don't. About a third of those, even with overt hypothyroidism, don't need to remain on medication long term. It just gets better on its own. And another group, with some of the efforts that I'll talk about, that can raise their odds as well. So why would they want to quit? Well, better not to take a pill if you don't need it, right? But then there's the cancer risks, and there's the higher risk of mortality. And there's the fact that the medication is not the same as what your body would make, and it can inhibit your body from all the things that it would do behind the scenes. A lot of folks on medication, they always have ongoing thyroid symptoms. They feel like there's too much or too little, and this can happen even if the blood levels are normal or even if they're optimal. And that's because making a hormone is never the same as taking a hormone. And if your body can make even more of it, that's always a win. It's always a better thing. So then what's the process? How would someone move forward with this idea of getting down to less or getting down to none? Well, think about a 3-month preparation window. There's a couple things to do during that window. First one is make sure you're not on too much medication. The reason for that is your thyroid wants your thyroid to repair itself. You want it to get better and heal and get larger and work better than it did before. For that to happen, it has to respond to a signal called thyroid stimulating hormone, or TSH. Now, if you're taking medication and you're on too much, your TSH might be below range or flatlined. And that's a dangerous thing, but also it makes to where your thyroid really has no chance of getting better. So yeah, first step would be making sure that your TSH is not suppressed, making sure you're not on a massive overdose of medication. The next step is to start thinking about your iodine intake and getting that to a good range. So what's the connection here? Well, your body needs this certain window of iodine, and thyroid meds have a lot. So when you're on thyroid medication, you're pretty much always at the high end of that window. And being there also makes it hard for your thyroid to get better. Weird thing to think about, your thyroid needs iodine, but once you get too much, it's so powerful that your thyroid has to shut itself off, or else the extra iodine would cause it to go just totally out of control. So yeah, so too much iodine is just like none, and that also breaks your thyroid, makes it not have a chance to recover. And there's a lot in the medication. So towards the interest of needing less medication or even none, you want to make sure that there's not any extra iodine getting into your system besides just a normal basal safe amount. The Thyroid Reset Diet walks you through that. The book has a reset stage and a maintenance stage. And for helping to lower your need for medication, you want that reset stage. That's going to bring you to about 50 to 100 micrograms of iodine per day. Totally safe, totally appropriate, and that's the best window for the thyroid to have a chance to heal itself. Once you've gotten to your target, you've lowered your medication, things have stabilized, there is a maintenance stage to the thyroid reset diet. That gives you more leeway. You still want to stay away from the foods that are the most damaging to your thyroid, but it gives you a broader window so you've got more options, and that's always a good thing. Uh, and you also want to make sure that your micronutrients are favorable for your thyroid as well. The one that you want to really measure and know if you need it or not would be iron. If you're low in it, it's totally critical to get it built back up again. If you're not low in it, it's just not necessary. It's not the kind of thing that you can easily overload on, but it's possible. So yeah, you'd want to be aware of that. And there's quite a few things I've written about iron, your iron needs. The short version for most people is that when ferritin scores are below 50 and you're on thyroid treatment, you can probably do better to have that higher, somewhere closer to 100. So that one is more specific. There's many other nutrients that are just always useful. Omega-3 fats, magnesium, zinc, molybdenum. There's critical things that you need for a good immune response, for good detox, and for good repair of thyroid tissue. And I put all of those into a blend called the Daily Reset Bundle. That's a combination of Thyroid Daily, which is a one-a-day thyroid micronutrient, then also calcium magnesium, and Omega Pure, which is a low iodine, safe version of fish oil. So those are like the foundation of everything else you would do with micronutrients. Next up, we would think about helping your thyroid grow. And some nutraceuticals have been shown to help it do just that. Some have also been shown to help your body respond better to thyroid hormones and also help your body clear other waste that can be slowing down your thyroid. Those are found in hypothyroid support. So that's also useful across the board for those wishing to discontinue medication. Then we think about how your body uses these different thyroid hormones. So there's T4, there's T3, there's T2, and there's lots of balance and ratio amongst them all. And T2-T3 ratio helps your body take whatever you're ingesting, and as you're ingesting less of it, and make those into the ideal ratios. That makes it to where you can taper with your doctor's guidance with less chance of symptoms and feeling better along the way and best chance of a good outcome. So that's the T2-T3 converter. So across the board, when you're withdrawing on thyroid medications, the Daily Reset Bundle, the hypothyroid support, and the T2-T3 converter are good foundational micronutrients. Next up, we think about if there is an autoimmune response. If you know you've got Hashimoto's, then lowering that immune response will also improve your odds. And that's what antibody support is for. And that's really the last one on that list. Now, you may have Hashimoto's and not have measurable antibodies. Some people, they only know about that because it's high on, it shows up via signs in their ultrasound. There's signs of the whole autoimmune attack. Things like hypervascularity, heterogeneity. These are signs of Hashimoto's, and that can be there even with negative antibodies. So if you've got autoimmunity, you want antibody support to lower the inflammatory response and help your thyroid have a better chance of getting better. So we've been doing this for 3 months now, right? So we've been making sure that you're not overdosed on medication. You've been following the reset guidelines on the Thyroid Reset Diet, and you're building up your micronutrients. And those blends contain all those essential ones. Now you want to check and make sure that you're at a good iodine window. This is where a urinary iodine to creatinine ratio test is super helpful. This is a random urine collection. It's not a 24-hour. You can even do it any time of day. And the goal is to see your urinary iodine below 100 micrograms per gram of creatinine. And I want to just repeat this. There's different urinary iodine tests, and some are just urinary iodine. Those don't cut the mustard. We're talking about a urinary iodine to creatinine ratio test specifically. Now, you don't have to test. You don't even have to take those 3 months in advance. A lot of folks do fine without. But if you do, this greatly improves your odds. So what if you're not below 100 micrograms on this test? Well, it means one of two things. It means that there's still some iodine getting into your system that's above your goals, or it means that you had so much in your body before, you've not yet cleared it and got back down to a range. That second scenario is not as common, and when it does happen, someone usually knows they were taking a really unusual dose of iodine for a while. So yeah, it's usually the first one unless you knew you were on a whopping dose for quite a bit. And if that was the case, you'd want to just double down on your efforts, give a couple more months, and recheck again until you get to that window. When you're at that low iodine window, the process of tapering goes so much easier. So yeah, in most cases, I would encourage getting there and stabilizing before attempting and before pushing it. So the process itself, now this is something you want to do with your prescriber or with someone who is a de-prescriber, someone who knows how to walk you through this. And here's some things to expect. Typical time frame is 2 months, meaning 2 months during the active taper. The measurements of your thyroid output aren't really meaningful until at least about 3 months after the taper has completed. So big pitfall to watch out for. In a lot of cases, people can be going through a taper, doing really well with it. And a doctor might check their levels and find their TSH is really high. The doctor gets concerned just because they don't understand, and they push them back on medication. Here's the deal. It's normal for your TSH to elevate during the taper. It's desirable for your TSH to elevate during the taper. That's how your thyroid gets back in the game again. Now, there's a point at where thyroid labs can say there's problems. And there's a point, but first symptoms are what show that. And so a doctor has to really know how these tests look differently during the time of the whole taper process. And symptoms can happen. Kind of an odd thing, but many people, especially early along in a taper, they actually have hyperthyroid symptoms, especially related to their heart rate, sometimes their blood pressure. And this is interpreted as being a sign that not only is the thyroid working again, but it's working again maybe more than it needs for a little bit. And in pretty much all cases, it does get a handle on things, but it's overexuberant at first. So that can happen, and be aware of that. And of course, it's also possible to have hypothyroid symptoms. One can feel mostly kind of just tired or vaguely weak or out of it is most typical. And for about a third of people, that's bad enough to where they choose to stop the taper process. And whichever step they're down to, they choose to remain there and not go further till maybe some point in the future. Another third of people, they have symptoms, but they recognize them as minor and they recognize them as things that will not last, and they keep going and the symptoms don't last. And another third has pretty much no symptoms. So those are the main ways that it plays out. When it's all said and done, you do want to really get a good baseline reading, and 3 months after the taper is the earliest time for that. It's nice to watch another 3 months afterwards as well to get a sense on where it levels out afterward. And it's good to talk, of course, this is done with your doctor, and it's good to connect with your doctor halfway through the taper. Bounce off any symptoms you're having, bounce your experience off of them, and just get a sense of how the whole thing is working. They may choose to test, they may choose not to, but again, if you do test in the midst of it, the doctor's got to know how to interpret this. In quick note, this is something that, in terms of likelihood, somewhere around 84% of people on thyroid medication can successfully reduce their medication, and about half can come off entirely. And I've got to say, it's super rewarding when someone is able to even reduce. People are so happy about that. And it's really common that they just feel better overall. Their bodies are working better and they're aware of that. And they're grateful to be less dependent upon medication. So it's something that is a really huge win. It's very often possible, and it represents a big positive gain in health. It means your body's working better again, and that's the whole goal. All right, Dr. C with you. Take great care, and I'll see you again real soon.